will highlight, again, findings from a very large randomized phase 3 study evaluating how less frequent use of zoledronic acid impacts bone fracture risk and side effects in women with breast cancer and bone metastases. And this is going to be presented by Dr. Gabriel Hortobagyi, who is a professor of medicine at MD Anderson Cancer Center and is a past ASCO president from 2006. Dr. Hortobagyi.
Thank you, Dr. Gantz. Good morning or afternoon, ladies and gentlemen. Over the next few minutes, I will summarize the efficacy and safety results of the OPTIMIZE-2 trial, which compared continued zoledronic acid every 4 weeks with the same drug given every 12 weeks in women with bone metastases from breast cancer. As background, patients with breast cancer metastatic to bone are at high risk of skeletal-related events, which are defined as pathological fractures, spinal cord compression, or the need for radiation therapy or surgery to bone. Zoledronic acid is a third-generation bisphosphonate used to reduce the risk of skeletal-related events in such patients. It is administered every 3 to 4 weeks as a standard of care by intravenous infusion at the dose of 4 milligrams. But like all bisphosphonates, because there are others used for this purpose, zoledronic acid has some safety concerns, such as osteonecrosis of the jaw, atypical midshaft fractures of long bones, and chronic kidney function impairment. Therefore, we hypothesized that less frequent dosing with zoledronic acid could have distinct advantages, especially following the initial induction phase. This slide shows the trial design. Patients with breast cancer and bone metastases who had received at least 9 doses of bisphosphonates during the previous year were randomized in a 1-to-1 ratio to continue receiving zoledronic acid every 4 weeks or to receive the same dose of the drug every 12 weeks. Initially, there was a third arm consisting of placebo administration every 4 weeks. However, that arm was dropped after it became apparent that it was a major obstacle to accrual. 412 patients were registered on this multi-center trial, and 403 were eligible and randomized. The baseline patient tumor and treatment characteristics were evenly distributed between the 2 arms of the trial. These results are presented at a median follow-up of 11.9 months or 1 year. And at that time, the every 12-week dosing schedule was non-inferior to the every 4-week zoledronic acid administration. The fraction of patients with a new skeletal-related event during the trial was 22% and 23% for the 2 arms, respectively, with a p-value of 0.724, or clearly not significant. As shown by the Kaplan-Meier curves, times to first on study SRE were similar in the 2 arms, with a hazard ratio of 1.06, again with a non-significant p-value. The safety results are shown on this slide. There were fewer adverse events leading to dose adjustment or interruption in the group receiving the less frequent infusions, and renal function impairment, shown on the right side, was less frequent in the group receiving the drug every 12 weeks. We conclude that the efficacy of continuing zoledronic acid for an additional year at the reduced dosing frequency of every 12 weeks was non-inferior to that of every 4 weeks among patients with metastatic breast cancer involving the bone who had previously received zoledronic acid or pamidronate, another bisphosphonate, for at least 9 doses, using a non-inferiority margin of 10%. The safety profiles were similar between the 2 zoledronic acid dosing frequencies, with some numerical decreases in the less frequent schedule of administration. Due to some design limitations, such as the relatively modest size of the trial and the assumptions that go into a non-inferiority trial, the non-inferiority claim should be interpreted with caution. Thank you very much for your attention.